Hello, everybody. Here we are to talk about retainers in orthodontics or post-orthodontic treatment. So, what is the role of a retainer in orthodontic treatment, and what can we expect? What is the reason to apply a retainer? And usually, question is for how long? Okay. So, first thing is, why should we apply retainer? So basically, what happened is after we move the teeth, it happens a sequence of biochemical sequence of factors. In this, during the treatment, we have presence of osteoblasts, osteoclasts, osteocytes, and a cascade of biochemical things, which is not really relevant in this moment because this is a very long topic. But we need cells and biochemical structures to make the teeth move. So when we put a bracket in the genetically, when I put a pressure, we stimulate the presence of osteoclasts, and the osteoclasts remove the bone in that pressure area. And the traction area, we stimulate the presence of osteoblasts, and the osteoblasts deposit the bone or form the bone in that tension area. Okay. So this is the very, very superficial genetically explaining how the teeth move. But when I finish and I remove the brackets and we stop the treatment, usually we have at that moment still the presence of this turnover of osteoblasts, osteoclasts. They are still there, they are still working, and the bone, if I can say in a friendly way, is kind of soft. Okay, because the bone is still not absolutely rigid, with fully formed with the bone surrounding the roots of the teeth to maintain stable position of the teeth when we remove. So usually the turnover of this full formation of bone to keep the teeth very stable is about 3 months. So it's the same as when I fracture a bone and I have to fixate with some fixator, and this fixation takes about 3 months to heal the bone, and I can remove this fixation and I can walk, okay, or I can turn back to my practice tennis or use my hands. So the same process happened in the mouth. This is the same bone turnover process. So it's about 3 months. In the lower teeth, because the characteristic of the mandibular bone is a little bit different, because it's more corticalized bone than cancellous bone. So this is different type of bone. On maxilla, we have the bone a little bit more, let's say, with spaces in between. There's a little bit more spaces. And in the mandible, the bone is dense. It's really more rigid. Because even embryologically talking, this is a different formation. And the mandible bone has the characteristic of tough bone. On the maxilla, the bone is softer. So we expect the capacity of movement of the teeth on the maxilla a little bit more easier than the capacity of movement of the teeth on the mandible, and demands different forces and so on. Another topic for conversation, okay? And when I finish, what happened is I need to maintain that position for a period of time, usually 3 months, to have the opportunity for the bone to heal fully 100%. So now the patient can use the teeth to swallow, to chew, to speech, to use in life without any risk for relapse of position during the orthodontic treatment. And here comes a problem. Usually the dentist or the orthodontists keep this retainer for a very long period of time. And this is not really the ideal thing. And I will say, and I want to tell you why. If my diagnose, the position that I plan, the position that I finish the orthodontic treatment is ideal in terms of function, occlusion, and everything, I can remove the retainer peace of mind, no problem, and I have no big chances for relapse. But if the occlusion is not that ideal, and if the occlusion is not so nicely finished, I will have a tendency for relapse. Relapse of what? The teeth will tend to be crooked or move in certain directions because I didn't plan very well. Basically 2 factors. Factor number 1 is the mandible in space. And factor number 2, the occlusion to maintain the mandible in that position that I supposed to plan, and I didn't plan very well. So if the mandible is very bad position and the occlusion that I finish is not really maintaining anything, the occlusion itself, the function of the patient using the mastigatory system itself will make the teeth to relapse. It's not because it's a natural process. It's because the mandible is attempting to find a better position and the teeth are in between. So it's just very simple. If I retain with a fixed retainer any position in where the mandible is attempting to get a more physiologic position, the retainer happens to drop frequently. So the patients in where the retainer drop is one situation in where probably your case is not very well finished. Another circumstance is the retainer maintaining the mandible in a position which is not ideally by the contact of incisors in interference. The mandible will somehow adapt a little bit in another position to avoid that interference. Usually the mandible slide back or to the side, and I can cause compression in one joint or both joints, and the patient can start to have a click or can start to have pain in the ear area or the muscles and become painful in the face. Another situation is the patient has no problem in both mandible or joints, but the periodontal and the bone will suffer and start to resorb the bone because of that frequent interference. And instead of the mandible adjust, who will adjust and adapt is the bone. and the bone can resorb until the patient loses the teeth. Okay? So the fixed retainer for a very long period of time makes no sense because, first of all, the case is not very well finished. If you believe in your plan, if you think your plan is good, I don't need retainer for more than 3 months because this is the turnover of the bone to heal. After that, any relapse is because the occlusion is not very well finished. So if you maintain the retainer, especially the fixed retainer, for a very long period of time, now I am in certain situations that will be in trouble for my patient, either to joints, condyles, mandible in space, interference to incisors. You can have abrasion of the teeth or periodontal defect. So this is what we should not do. So retainers must be for a very short period of time until the patient heals, until you can check up the occlusal system of your patient. If you think after checking up the occlusion of the patient with Bruchshackers, for example, occlusograms, or checking with articulator papers, some contacts, and you do all the final fine-tuning and little adjustments that you think is necessary, now is the end of the treatment, so you don't need that retainer anymore. But if you maintain the retainer and the patient always relapse and slide or go to the side or drop the retainer, certainly please check your case. Maybe you need to bone the brackets again or offer the patient a second option or orthodontic solution, for example. So to have the patient in a new mandible position and facilitate, there's no interference, especially on the anterior teeth. So retainers can be fixed, can be removable. Okay, usually we do removable on the upper, and we do rigid fixed retainers on the lower, canine to canine or bicuspid to bicuspid, okay, depending on our skull from where you learn. And on the upper, removable, but both situations are the same concept. Okay, once the period of healing is finished, there's no need to keep retainers for that long. If you keep the upper retainer a little bit longer, as this is not rigid, okay. But if you keep any rigid retainer for a very long period of time, it's very risky for the patient, and you don't give the patient a chance to adapt. So in this situation, the relapse is beneficial, not aesthetically speaking, but beneficial for the mandible position, or to protect the joints, or to protect the periodontal situation, okay, or to avoid abrasion of the teeth. So I hope this little video is very beneficial for you. And here I have just one case in where my patient kept the retainer for a very long period of time. In this situation here, the patient kept for 10 years. And when the patient got back here, the patient came presenting a joint problem. So I had to remove this retainer because the patient didn't come anymore to my office. So the patient got back 10 years after with the retainer. So we need to be very careful with our patients when we cement this. Call the patient to our office and to check up the occlusion of the patient frequently, and instruct the patient that one day we need to remove this. Okay, so I understand sometimes you want to have a very well aligned lower incisors forever in life, but sometimes it's not possible. Okay, but in case it's possible, adjust the occlusion. So remove the retainer and give a chance for adaptation. And this is really much better than have a problem on the periodontal ligament or the bones or in the joint. or muscles, okay? So you avoid this problem just by removing a retainer after 3 to 5 months. Hope you enjoy. If you have anything to comment or anything else to contact and to question, just click here in my bell to join our club, okay? Or press the like and leave your comment. So I will be more than glad to exchange with you some information, okay? See you in the next video.